Dan Williams, Survive Outdoors. What we're going to do today is talk about a injury to your hand. I did a short little while ago about it. Specifically an injury to your thumb. And the reason why I'm going to talk about this is it's fairly common, especially hiking and then falling. It's also very common in sports, and we'll talk about that. Why is this important? Why am I bringing this up? Because it is often missed by young providers, healthcare providers in the field, in urgent care, even in the ED. And if you're aware of it and you hurt your thumb out on the trail, you are going to be aware of what you would like them to look for in case they go, oh, it's not broke. It's no big deal. So that's why this is an important video. So what we're talking about specifically is your thumb. And if you look at the model, we're going to be talking right here. So that would be right here at this joint on your thumb. And there's a ligament that runs right here, and that is called the UCL, the ulnar collateral ligament. And if I take some of this eraser and I try to mimic that, I am going to put that, it connects this bone to that bone, just like that. See that? So what happens? Well, originally in the 1800s, they called this gamekeeper's thumb. And the reason why they called it gamekeeper's thumb is because back then they would kill birds and they would kill rabbits by hitting their neck, and then this would tear, hence gamekeeper's thumb. They were getting things ready for market. It's also common with people that mountain bike and they got their thumbs up and they hit a limb. It's common when you fall on an outstretched hand, which we call foosh, falling on outstretched hand. Genius, right? So we have that one. And with football, baseball, a ball coming and hyperextending that thumb back. So you go in, you get it x-rayed, it's not broke. And they'll put you in a splint or whatever, and you're good to go. And 6 weeks later, 8 weeks later, it's still killing you and it's hurting. So at that point, you want to say, hey, maybe we should do an MRI. Maybe, since I saw this YouTube video on Survive Outdoors, we should check for a UCL tear and get an MRI. Well, where have you heard that at before? And then you mentioned the channel, Survive Outdoors, see? So there's two ways that this gets injured. One, this comes off here and gets pulled off. The other thing, it gets torn right in half, like these photographs here. And then there's two repairs. There's either reconstruction of that ligament, or they just repair that ligament. Both have a fairly similar outcome. And the treatment on this, once they repair it, is it got like a 90% good outcome. But if you tear this, what happens is this thumb gets lax and it's flexible. I mean, when I examine someone and I pull here, I'm going to feel laxity. It's going to hurt them a little bit, but on x-ray, there's no fracture. So that's a UCL tear. Now, you're out in the outdoors, you got your 30-pound backpack, you're hiking down the trail, and you fall on this outstretched hand. And you're like, oh, damn, that really hurts. I remember, Survive Outdoors. We're going to splint this. I'm going to show you how I want you to splint this. I don't want you to get you a SAM splint. I don't want you to just cut out a little strip and splint the thumb like that. So this is we call this a gutter splint. So you have your lightweight aluminum SAM splint. You have to immobilize this thumb and wrist. So you're going to put this like this. You're going to wrap this around this thumb like that. Then, I don't know if I can do this with one hand. We will see very shortly here. You get you some Coban or Medi-Rip. And you're going to, I like having just a little bit of the thumb showing. And you're going to wrap this puppy around. Now I'm going to do it. When you wrap, and I've got tons of videos on this, you wrap around half and then half again. This gives even distribution on the wrap. and you wrap it like that. And that's very secure. You want the thumb where you can't move it. All right, you see how that looks? Now they make, and you're going to see this picture here, where it's a splint that just covers that joint, and that's really nice. But you're in the outdoors. That's what we're doing here. You're not going to be carrying all these different types of splints with you. This works fantastic. If you don't have a SAM splint, you can take bark. You better have the Coban or Medirip in your pack. That's used for all kinds of things. But you could take bark, pad the bark, and you could do this same type of splinting maneuver. So the gutter splint method, you want the whole thumb immobilized. So how long does that take to heal? I'm reading some very recent articles with professional athletes. They're healing in about 6 to 8 weeks. You have the surgery, you're in a splint for about 6 to 8 weeks, sometimes 10 to 12. It depends on a lot of factors. It depends on the severity of that tear. Did they do a reconstruction? Did they do a repair? How old you are? Blah, 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 blah. Are you a smoker? Smokers take longer to heal. So that is a gamekeeper's thumb. It's also called a skier's thumb from skiing, and fairly common injury. Now you know how to take care of that in the outdoors, and you won't risk further injury to it. All right. I haven't forgot about the thumb injury. I'm actually seeing that guy tomorrow, and I'm going to give you a sequence of the healing process, and we're going to talk about how would you repair that in the outdoors, or at least how would you bandage it to get back safely. All right, guys, if you like that, give me a gamekeeper's thumbs up. Keep your eyes on the horizon, your face to win. Stay safe.